Hello and a very warm welcome to all the viewers of Doordarshan as we welcome you all to the 10th National Quality Conclave, which was organized at the Sri Fort Auditorium, with the theme being Creating an Ecosystem for World-Class Quality. The conclave this year was co-hosted by the World Health Organization and Quality Austria Central Asia, along with the American Society for Quality being the knowledge partner.
The 10th National Quality Conclave witnessed massive international participation as speakers, delegates, students, along with multinational companies, specialty hospitals, universities, as well as state and central government healthcare units took part in it at Sri Fort Auditorium, New Delhi. This event was well supported by the American Society for Quality India as its knowledge partner and the World Health Organization as its technical partner. Creating an ecosystem for world-class quality was the theme for this conclave.
The 10th National Quality Conclave was inaugurated by Sri Amitabh Kant, IAS Secretary, Ministry of Commerce and Industry, who also graced the occasion as the chief guest for the function.
The first day of the 10th National Quality Conclave started on an auspicious note with the lighting of the ceremonial lamp by the dignitaries, namely Mr. Amitabh Kant, Secretary DIPP, Mr. Adil Zainul Bhai, Chairman QCI, Mr. Arun B. Thapa, WHO Representative to India, Mr. R. Mukundan, Chairman NBQP, and Dr. Ravi P. Singh, Secretary General QCI. Discussions were held on issues ranging from environment, healthcare and education to infrastructure and employment. Mr. Amitabh Kant, Secretary Department of Industrial Policy and Promotion, Government of India, emphasized on the need for opening up the Indian economy in order to become an essential part of the global supply chain. He suggested that the collaboration of the private sector with the government will bring about the best in India.
To my mind, one of the key objectives in the last 1 year has been that make India one of the easiest and the simplest place to do business. So we've actually done away with a number of regulations, procedures. We've used technology to leapfrog. We've created an e-biz platform where we've integrated services. 14 services of Government of India, but over a period of time we'll integrate all the states, all the services of Government of India, so that there is one paper, one point of payment which will then get a portion. So make India easy and simple place to do business. Secondly, to my mind, in today's world, if India has to grow at rapid rates, India must become an integral part of the global supply chain. India can't live in isolation. It must open up its economy and become a very integrated part. And therefore, in the last 1 year, India has rapidly opened up its economy. It's opened up its defense manufacturing, its railways, its construction, its medical devices, its insurance, pension funds. All these sectors have been opened up. And what we've seen in the last 8 to 9 months since the launch of the Make in India initiative is that the FDI inflows into India have grown by 48%. At a point of time, 48% when the global FDI inflows have slowed down by 16%. So India has made a huge progress in the FDI regime, and it is actually in reality one of the most open economies of the world. And the attempt is that these programs should make India make a paradigm shift, evolve and take it to another level of growth. And that is why we have people like Adil Zainul Bhai, who's been the chief of McKinsey, to lead an institution like Quality Council of India. And he's brought in a lot of young energy, a lot of young vibrancy, a lot of young dynamism to an organization like Quality Council of India. That is why we have people like Mr. Mukundan, who's the chairman of Tata Chemicals, to drive NBQP. So we have, the whole objective is that how do we partner the best of private sector with government to unleash this unique energy of India. And to my mind, If India is to excel in the world of manufacturing, it has to focus on one thing and one thing only, and that is world-class quality.
Adil Zainul Bhai is the chairman of QCI and the president of HBS's Alumni Association in India. A mechanical engineer from IIT Bombay and a postgraduate from Harvard Business School, Mr. Adil served as the chairman of McKinsey India.
This conclave is a lot bigger than it was last year, which shows that there is a lot of interest and that the amount of interest in India on quality is increasing. So we've got very good responses this time. This conclave is about 1.5 times the size of last year's conclave. This conclave represents an acceleration of India's efforts on quality, because we cannot make in India successful without improving quality. We cannot improve the quality of lives of our people in India without improving quality.
How do you monitor the quality?
For each industry, we set quality standards, and therefore you can see if they meet those. And they have to go through certification by an independent agency to see if they're meeting the quality standards that have been set up. It's not a government inspector, but it is independent certifying bodies that monitor whether or not you're meeting the quality. If we want to export to the rest of the world, we have to meet their standards. So if you look at pharmaceuticals, for example, any drug that is exported to the US or Europe has to meet very stringent quality standards set by them. And most of the top 10 pharma companies in India, most of their plants are certified by the FDA or the European agency. The biggest problem comes when we're not exporting, but we're trying to improve the quality of goods and products for people in India, where in the past anything goes, So even at pharma, if you look at products that are only sold in India, because they don't have to meet FDA standards, their quality is often quite low. Our goal is, I think, over time, that international standards also should become our standards. Why should we settle for something less? I think one of the big pushes by the Ministry of Ayush, which is Ayurveda, Yoga, etc., Unani, is to in fact make those acceptable around the world. To make them acceptable, you have to establish a standard and make sure that those companies are hitting those standards. So Ayush is a very important program that we are undertaking to in fact certify the health professionals in Ayush.
The Quality Council for India, along with the American Society for Quality, organized an excellence workshop on healthcare and education that was held at the India Habitat Center a day before the 10th National Quality Conclave actually started off. Well, this excellence workshop was attended by several experts from all across the globe. Let us now show you some interactive discussions that were a part of that excellence workshop.
A pre-conclave conference cum performance excellence workshop on education and healthcare was organized by ASQ India on 6th August at Amaltas Hall, India Habitat Center. Paul Grizel, President Core Values Partners USA, and Mickey Roberts, Director Performance Management, shared their experiences on how US healthcare units have improved patient care, reduced fatalities, increased life expectancies, and reduced infant mortality. Speakers Dr. Joanne Stryker and Paul Grizel deliberated on how US educational institutions have improved the quality of academic delivery and enhanced student performance. Paul Grizel is the president of Core Values Partners USA. He has worked with many organizations that are state and national Baldrige Award recipients. He is a contributing author to Insights to Performance Excellence, an inside look at the Baldrige Award criteria published by the American Society for Quality. Paul shed some light on the Baldrige criteria and its functioning.
What are the major challenges that you see when we talk about healthcare and take India in that particular perspective?
I think that it's really up to India to identify what those specific challenges are that they face and to be able to develop either through government or private industry the approaches that they're going to use to address those unique challenges. Without a doubt, there are different challenges faced here than what we face in the United States. But what the Baldrige criteria as a performance excellence model forces you to do is to say, what are our strategic challenges? What are our strategic advantages? And how do we address those in a way that's going to meet the customer requirements, our patients' families, anybody that our healthcare system serves.
How do you think that this particular thing could be applied to our country over here?
Again, it's looking at your own organization or your country, your challenges that you face in healthcare, identifying what your strategic challenges are, what your strategic advantages are, developing a strategic plan to address that, and recognizing, based on what's important to the Indian economy and how it relates to healthcare, then what are our strengths and opportunities for improvement. The method that we're talking about here is one that allows a country, an organization, a school, a hospital to adapt to whatever their particular requirements are, what their challenges are. The real challenge is to just start making progress. Not to say, are we going to be like the United States in 10 years, but it's to say, are we going to be better than we are now in 5 years? Where do we want to be in 5 years, and then set the plan to accomplish that? Where do we want to be in 10 years, and set the accountable plan to accomplish that?
So how do you think the basic change in the psyche and the mental approach can be brought about within the Indian country, within India?
I think the challenges that India face are the same kind of challenges that we face in the United States and that any healthcare organization faces, and that's having sufficient funds to provide the kind of care that your patients want, that your patients deserve, and being able to provide that kind of care to everyone in India.
Dr. Joanne Strikey is the superintendent of Pewaukee School District. She earned her doctoral degree in leadership, learning and service through Cardinal Stritch University, where she also serves as a professor and site coordinator for the Masters in Educational Leadership Program and Superintendent Licensure Program. Dr. Joanne supports performance excellence more than compliance and accreditation, and feels that policy changes are required for performance excellence.
2013 National Baldrige winner of that is the highest award of US National Quality Award. And with us, Joanne, tell us about what do you think about the education system and how Baldrige can really help?
Oh, that's a great question. Well, first of all, I think education is one of the most important things that any country can focus on, whether it's the United States or India, because the stakes are high. We're creating a workforce, a future workforce. We're creating future citizens that we want to be meaningful and hardworking with good values. And so the stakes are high. And what I believe that the Baldrige criteria gives us is a systems approach so that we're working as efficiently and as effectively as we can in educating that group of students to be successful.
So was it about the award or it was something else?
It wasn't about the award at all. It was about having a great criteria, a terrific framework to work on so that I could lead my organization well and then get great feedback from people that understood and could give me advice, not prescriptive, but give me feedback about what our strengths were and what our opportunities for improvement were so that we could create that flywheel of improvement and get better faster. When we began our journey, 63% of our students went on to a 2 or a 4-year college, and that's now 94%. So we're creating life chances for students because of this systems approach. So was it worth it? You bet it was.
And do you think it will have any application in Indian context?
Oh, I think it has application anywhere because it's about working smarter. It's about working intentionally and mindfully in the name of student achievement and making sure that all parts of the organization, all parts are working effectively to that end.
And what do you think about the cultural compatibility between, say, American education system and Indian education system?
You know, I can't claim to be an expert on the Indian education system, but it's been interesting. Just in our dialogue today, we share many of the similar challenges in terms of equity, in terms of wanting our students to increase their achievement, and so we share many similarities and challenges.
Do you think there is any requirement of policy changes in order to implement any kind of performance excellence framework?
I would love to see policy changes for performance excellence. I believe it's better than any accreditation system that I've been a part of in education, and I wish that it would be something that more organizations would pursue as accreditation, because I think it gives you more meaningful feedback, not just a simple check, yes you are or no you're not. I can actually learn from the results I get from Baldrige. I think compliance is all about meeting a minimum set of requirements, and performance excellence raises the bar so that we're not just meeting that requirement, we are, but we're working more effectively and optimally in the name of student achievement. So I'm all about performance excellence, more than compliance and accreditation.
Mickey Roberts is the director of the Office of Performance Management, Tennessee Department of Health, a postgraduate in clinical ethics from Vanderbilt University. He has 26 years of experience as a public health practitioner. Roberts spoke on the major healthcare challenges faced by India and how to overcome them.
What are the major challenges that you see when you talk about healthcare in India?
In India and healthcare, scalability of performance improvement. What I mean by that is a clinic may be very, very large or it may be very, very small, isolated, just a few people. But are the processes consistent? Whether you're here in Delhi or whether you're in a very rural setting by itself, is the service quality the same? That was one of our challenges in Tennessee, was making sure that the service quality would be the same, because our greatest health risks are behavior related. Smoking, obesity, lack of good nutrition. So whether you're in a rural Appalachia community with just one or two people working in that office, or a very large metropolitan community, are you able to provide the resources to support all the people within your community within a reasonable amount of time?
But you do realize that the population base that we're dealing with over here is huge. In fact, it's the second largest democracy in the whole world compared to that. So how do you see that as coming as one of the major challenges when we talk about providing adequate and sufficient healthcare to all the citizens of the country?
Well, we can do it if it's a bioterrorism event or a disease outbreak. We mobilize, we put people into action. For example, in the States, one of our rules is in a bioterrorism event or an infectious disease event, we should be able to either immunize, vaccinate, or provide antibiotics to all our citizenry within 10 days. So, similarly, if here in India you have a plan in case there's a disease outbreak of some sort to take care of the people in the community, why can't we mobilize resources to provide good basic health care for the people at the same time?
So that can be achieved probably by step by step.
If we're based on the criteria that we use for performance improvement, you have to be intentional about it. You have to be able to leverage resources to make that happen. And so we're looking at keeping people out of the emergency room, saving costs, and from that cost reimbursement, being able to help increase the community's capacity for prevention through networking, connections. If you know where the people are, if you have the people in the community connected, who knows where everyone is and can reach them in a timely fashion, then yes, I think it's achievable. Mm-hmm.
So you talked about risk and innovation in your dialogue, two very important factors. But when you talk about the Indian economy, the first thing that comes is innovation and then follows risk. So what kind of innovative strategies do you see should be implemented when we talk about healthcare in India?
Well, I think there are a lot of initiatives that can take place in a community. But first, before I would talk about any disease category or any way to take an initiative, would be what are your greatest health risks in any community? That'll tell you where you need to innovate. If you know what the greatest health issues are in a community, that will tell you where you need to innovate. But to allow people the freedom to be innovative, that's the first thing. Many times we're a society of blame. We like to look for whose fault it is.
Yes.
And if we're afraid to take risks, then we'll never innovate. But if we have the freedom and the approval to try something new, then try it. Innovation will happen. But we need to reward innovation and reduce the fear of blame if something doesn't work.
Right, that's a very important thing, in fact. And the other thing that you mentioned was about the active ingredients and the ones which are not active. You mentioned that people and processes are the two ingredients which are obviously active in the whole process, and management is the one which isn't.
Right.
How do you see this being applied in India?
Well, let me start with what I think is basic for many societies is, do we have an organizational profile? People love to see an organizational profile. Who's in charge? Who reports to whom? If I think about it as a cake, that's simply the icing on the cake. The ingredients inside the cake to make it good are the people and the processes. So management's only role is to make sure the right people are aligned with the right processes so you're getting the most out of someone's work. It doesn't mean working them to death. It means allowing them to innovate and rewarding them for that innovation.
Recognizing and appreciating them
Yes,
also.
yes. Now we have pay for performance.
Right.
So if on a 5-point scale, you're either excellent, or you're valued, or you're advanced, or you're on the other side of the coin, your performance is poor or it's substandard. So now your raise is based on that scale. So it's pay for performance.
The pre-conclave drew to a close with the interactive and collaborative sessions.
But I don't want you to even think about Baldrige as an application. I want you to think of it as that management model. Leadership understands customer requirements and develops a strategy based on it.
Day 1 of the 10th National Quality Conclave also saw the book release of Quality Best Practices by Mr. Amitabh Kant, Secretary, Department of Industrial Policy and Promotion, Government of India. Along with the QCI DL Shah Quality Award distribution. This was followed by Plenary 1 and 6 concurrent sessions. The Plenary 1 was chaired by Mr. Adil Zainul Bhai, Chairman QCI. The keynote speakers were Dr. Philida Travis, Director Health Systems Development, WHO, spoke on Global Healthcare Initiative. Dr. Thomas Wattsmeyer, Head Personnel Certification Body, DGQ, discussed on guiding principles for quality in Germany, and Professor Anupam Sibbal, Group Medical Director, Apollo Hospitals, spoke on the topic, Is there a need for quality improvement?
In India, we've started that journey. Now, CGHS expects accreditation, whether it's from NABH or JCI or what have you. But really, there is very little incentive for organizations other than passion to actually want to go down this journey. And I think perhaps, under your leadership, QCI could actually sensitize the insurance companies to really look at accreditation. Because at the end of the day, there has to be some incentive for someone to invest huge amount of man hours, a lot of intellect, and a fair amount of money sometimes in structural changes.
We are talking about an ecosystem of world-class quality, right? In the morning, Amodji had beautifully presented what he said, and with a lot of passion and fire. But none of this can work when from 1947 we are at still 935 kilowatt per hour. I think you understand what I'm coming to. We are looking at an economy of 125 crore people who do not have power, and we are talking about health, like Dr. Sibal said. I wish some of the erudite speakers should go to the backward areas in the Himalayas, where I have been working for the last 18 years. And the watch stops at 1947. There are no communication worthwhile, there are no logistics, there are no worthwhile roads. And in terms of healthcare, I think you're asking for God. So given that scenario, sir, I think it is necessary that when we are looking at quality, the quality should emanate as a movement.
You know, we have a long way to travel. We'd like the country to grow 9% a year for 20, 30 years. We have to make a big push on quality, which we are making now, and it's gathering momentum. But maybe that push will get us from 10% to 40%, right? It's not that we are not at zero, which is great. We've made some progress, but we are not at 100%. So I think we'll get there. We agree that there are many, many, many constraints.
Concurrent session number 1 was on the subject Emerging Environmental Standards for an Improved Ecosystem. It was chaired by Dr. S.K. Sharma, Chairman, BIS Sectional Committee on EMS, and Mr. V.K. Medirata, Ex-Secretary General QCI. The participating speakers were Ms. Amarjeet Kaur, Dr. S.K. Sharma, Ms. Anumita Roy Chaudhary, and Mr. Sanjeev K. Besbaroa. The topic of discussion for the second concurrent session was Interventions to Improve Quality in Healthcare, Global, Regional and Country Perspectives. Dr. Nand Kumar Jairam, Chairman, NABH, and Dr. J.K. Das, Director, National Institute of Health and Family Welfare, presided over this session. Dr. Neelam Dhingra, Dr. Mickey Roberts, Dr. Krishna Philip Hort, and Dr. Chandrakant Laheria were the participating speakers. Dr. Krishna Philip Hort is the Senior Technical Advisor, Health Systems Governance and Finance, and Acting CEO at the Nossal Institute for Global Health, University of Melbourne. He has also been involved in the design and conduct of a range of health system research in areas such as governance and regulation of private hospitals, hospital accreditation, and non-communicable disease policy.
When you've come to India, what do you see are some of the major areas of concern that need to be dealt with utmost priority when we talk about healthcare over here?
Okay, yes. Well, of course, there's such an array of problems, but I think if we look at those that particularly put patients at risk, then many of those relate to hospital care. So the risk of hospital-acquired infections or cross-infection in hospital, the risk of inappropriate care, unnecessary care sometimes, and the overuse of certain medications, particularly antibiotics, are three key areas that India needs to address. But as well as that, we've got ambulatory care, which in India is a mixture of qualified and unqualified practitioners. How to provide the appropriate support and incentives to ambulatory care providers to provide better levels of care is another area that India could
And
work
how
on.
do you see some of the solutions coming to these problems? What kind of solutions do you think could be a help to some of these problems, first of all, on a priority basis?
Well, I think that initial work around improving the knowledge and capacity of medical care providers is important. Licensing or some form of registration. But the thing that the research has found is that an important aspect is the the motivation and attitude of the provider. Providing purchasing or payment mechanisms that provide incentives to provide good care rather than just to provide lots of medication would be another strategy that India could work on, yes.
The issue raised in the third concurrent session was improving the process of education for effectiveness. Dr. S.K. Salwan, former Vice-Chancellor PTU, was the chair of this session. The other speakers were Ms. Joanne Strike, Dr. Manu Vora, Mr. Pramath Raj Sinha and Mr. Dilip Ranjekar. Session number 4 was on Zero Defect, Zero Effect, the concept and its pull factors. Mr. Ramesh Pandey, Joint Development Commissioner, Ministry of Micro, Small and Medium Enterprises.
India is coming up with an altogether new concept, which many of you might have not heard, that is called Z certification, which encompasses every aspect of quality in manufacturing process and coming up with world-class product. How does it encompasses the quality management tool, quality technology tools, things related to energy efficiency, innovation, improved management system, or inculcating good culture into the manufacturing units. Not only that, the financial capacities also, and keeping in view the policy which the country has, either you say Make in India call of the Prime Minister or the National Manufacturing Policy of the 2012, which says that country has to keep pace of 12 to 14% of the manufacturing growth and to increase the contribution of the manufacturing sectors from 8% to 25%. And if we have to achieve such target, keeping in view the economy of the country, the concept like Z is not only relevant, but may be path-breaking in making manufacturing world-class in India.
And Mr. K. N. Ratan, Management Consultant, were its chairman. The participating speakers included Mr. A. K. Jain, Mr. Rajiv Chawla, Mr. B. S. Galgat, and Mr. Pankaj Rai. Quality healthcare for universal health coverage formed the subject matter for the 5th concurrent session. Major General Dr. Pawan Kapoor, Chairman Accreditation Committee NABH, and Dr. Saumil Nagpal, Senior Health Specialist, World Bank, chaired this session. Dr. Irina Papiva, Dr. Nijal Livisley, Dr. Aarti Verma and Dr. Sanjeev Kumar were the speakers. Dr. Irina Papiva has been competitively selected for the international position of Technical Officer, Health Systems in the World Health Organization, Southeast Asia Regional Office, Country Office for India. She started her new assignment in New Delhi in April 2014. She joined the newly established team working on health systems that closely works with the teams on non-communicable and communicable diseases.
As I mentioned in my presentation, nowadays WHO is promoting one of the most important concepts in public health, which is about universal health coverage, which is about to ensure that all people of the given country have access to quality services that are effective, and people get that without suffering financial constraint while getting those services. So what we have been witnessing throughout the years, that we have put much more emphasis on the financing of the healthcare and also on the addressing equity issues. However, the quality of care has been left behind. That is why WHO has decided that now it's time for India to address quality of care, and that is why we are supporting this conclave. Just to mention that World Health Organization works in the member states with the central government. So our national counterpart, actually the government of India and the Ministry of Health and Family Welfare, we don't go much to the ground root levels. However, we promote establishment of strong partnership in the area of health sphere. So, when it comes to the addressing of issues at the grassroots levels, so we are sure that there are partners, there are development partners, there are NGOs, there are other actors who are playing the role there at that level, while we are providing support to the government of India in the development of strategic approaches and in the development of the respective policies in the given area. As you probably heard, there are many improvements. We have heard a lot about, for example, increases in the life expectancy of Indian population. We are moving very fast towards reaching the Millennium Development Goals across many indicators, be that infant mortality rate, under 5 mortality rate, or maternal mortality rate. However, we should accept that there are still many challenges and we have a lot to do. And probably most of the challenges are related to the fact that there is a contrast. There is a big gap between the central and state level, between the urban and rural population. So we are talking here about equity-related concerns. That is why we also are promoting in our concept of universal health coverage that the services should be equitable. So everybody can benefit from using those services, be that poor or rich, be that urban population or rural population, men, women, adults, children. Everybody should have equitable rights and equitably access healthcare services.
Promoting quality of products and services and improving quality of life was the theme for session number 6, which was chaired by Mr. R. Mukundan, Chairman NBQP, and Mr. Anil Relia, Director NABL. The speakers were Major General Taran S. Sidana, Dr. Ashish Rakheja, Mr. Anil Relia, and Mr. Amit Dhanuka. With this, the first day of the 10th National Quality Conclave concluded favorably.
Well, as we all know, the theme of this year's 10th National Quality Conclave was creating an ecosystem for world-class quality. And the morning session of the second day of the 10th National Quality Conclave, the speakers included Mr. Paul Grizel, President, Core Value Partners, USA, and Mr. Nigel Croft. So let us now show you some glimpses of the morning session that happened on the second day of the 10th National Quality Conclave.
That big data.
The day 2 of the 10th National Quality Conclave comprised one main session, that is plenary number 2, followed by 3 concurrent sessions. Mr. Nigel Croft, Chairman ISO TC 176 SC2, and Mr. Paul Grizel, President Core Values Partners USA, were the keynote speakers for plenary 2. Dr. R.K. Tyagi, President-Designate, Aero Society of India, was the chairman.
The question actually emphasizes the conceptual errors that have been committed in the past by all of us in terms of this concept of preventive action. The very acronym CAPA is itself nonsensical. And I say this every time I go to the United States. CAPA is wrong. You don't take corrective action and then preventive action. If somebody renamed that PACA, preventive action, corrective action, I could actually associate myself with that. But it perpetuates the myth that once something has gone wrong, parties. And I think it's important, it's not just supplier and the organization. It goes beyond that. It looks at things like outsourcing, the inclusion of outsourced processes, the sometimes quite intimate, complex interfaces between where we may be including the customer and the supplier in joint product development activities, in innovation activity, and the organization itself, in order to achieve ultimate customer satisfaction. Not just treating us as silos and I'm looking only at my contractual customer.
It's that big data, it's that understanding the performance of your organization through accurate data. We call it the brain center. It's where you go to make decisions in all those other categories. And finally, the core work, workforce and operations, is people doing processes. That's how work gets done. All of the things that we've talked about already, ISO, fits very well within the operations category and touches others. How do we improve processes? How do we ensure that we're designing, managing, and improving processes in a way that drives results? And finally, at the end there, the results category says, when we have those processes all working together well, are we getting the results we want?
Session number 7 was on creating quality infrastructure and was chaired by Dr. Sarita Nagpal, Principal Advisor CII, and Mr. Paul Rizal, President Core Values Partners, USA. The speakers were Mr. Sudhanshu Pandey, Ms. Hedi Lund, Mr. Ian Fraser, and Mr. Shashikant B. Gavaskar.
The 10th National Quality Conclave saw several seminars and conferences being conducted simultaneously across the 2 days it was held for in the Sri Fort Auditorium, New Delhi. And the second day was not much of a surprise. As it was, there were several seminars and important ones that were conducted in all the auditoriums of the Sri Fort Auditorium. This session was chaired by Dr. H.R. Nagendra, who was Chancellor S. Vyasa Yoga University, and at the same time by Dr. G.N. Singh, Drug Controller from the Government of India.
The topic of discussion for session number 8 was improving quality of healthcare in practice. Selected initiatives. Dr. H.R. Nagendra, Chancellor S. Vyasa Yoga University, and Dr. G.N. Singh, Drug Controller, Government of India, were the chairs. Dr. Darshan Shankar, Dr. Ishwar V. Basava Reddy, Dr. Boregowda, and Dr. Balaji Utla were the speakers. Dr. H.R. Nagendra is the Chancellor of the Institute of Transdisciplinary Health Science of Technology. After completion of his PhD from IISc, he moved to NASA Marshall Space Flight Center, USA as postdoctoral research associate in 1971. He returned to Vivekananda Kendra in 1975 to pursue human engineering. Dr. Nagendra was asked by the UGC to bring the wisdom of yoga to university campuses, and the Vyasa had 9 campuses in which yoga centers were established. With the success story growing further, the UGC accorded a deemed to be university status in 2002 to S. Vyasa, for which he became the first Vice Chancellor.
Quality Council of India, in collaboration with Ayush, has brought out a competency model to certify yoga teachers all over the country. As you probably know, there are lakhs of people who are practicing yoga and teaching yoga, but some standardization should come, some quality should come up. Their initiative of Farnell, Devareji and others, now there is a competency model that is brought. Anybody can apply for this, and there is the knowledge and the skill aspect will be tested by the various procedures, and if they pass that, they can become the yoga teachers. That will be quality QCI, and also Ayush will give the certification. It's a very big thing that has happened in the whole country.
Dr. Ishwar V. Basava Reddy is the director of Morarji Desai National Institute of Yoga, an autonomous organization of Department of Ayush, Ministry of Health and Family Welfare, Government of India since June 2005. Dr. Basava Reddy has more than 25 years of professional experience in yoga education, therapy and research. He has imparted yoga training and therapy to more than 70,000 people.
No, basically yoga is essentially spiritual, but it works at the body level, it works at mind level. And most importantly, and today we have some other forms to keep ourselves fit. But there is only one form which can integrate body and mind. That's why in the entire globe it is used as a mind-body medicine. So medicine is a big word, but we would like to mind-body coordination is very much essential. All our yogic practices are devised in such a way that there is a mind-body combination. If you are doing only physical activity, that's not called yoga. That's one thing. So how to develop it? Yes, in the presentation also I mentioned, we start with some physical movements, but let us come into mind-body practice. So we start with breathing, let us convert into the energy practice, the pranayama. We start with concentration, with prolonged concentration leads to meditation. So these are all the gross to subtle and subtle to the subtle. So this is the process we evolve. So in the beginning it's only the physical level, but slowly we go to the subtler level. In the prolonged practice of yoga, ultimately it leads to spiritual life. First of all, I am producing competent yoga professionals through our educational and training programs. Then every day nearly 800 to 1000 people are getting yoga training or therapy in our institute. One. Then we have established preventive healthcare units in the CGS dispensaries. 20 CGS dispensaries are there. We have a therapy center in the tertiary hospitals. And we have established wellness center in each district, 59 districts. We have started wellness centers, yoga wellness centers with NGOs in the district. That means with a limited scope, we are working at the tertiary level, at the wellness centers, and also in the district level. So apart from this, we are conducting orientation programs for all the trainers and bringing the standards and helping the ministry to provide the standard curriculums and training programs, booklets, leaflets. In the International Day of Yoga, and our institution is the major institution which has contributed for the developing the protocol, and the CD has been brought out by us, and even the presentation made in the Rajpath was from our institution. So that means it's being a premier institution, we are doing a lot of job for the promotion and propagation of yoga.
The conference session number 9 involved discussion on increasing employability and acquiring skills for mobility across borders. Mr. Pawan Kumar Agarwal, Joint Secretary, Ministry of Skill Development and Entrepreneurship, and Dr. Manu Vora, Chairman, Business Excellence USA, presided over it. The speakers were Mr. Vijay Krishna, Mr. Grant Taylor, Dr. Jayanti S. Ravi, and Ms. Gayatri B. Kalia. We interacted with Mr. Grant Taylor, who is the head of sector Essential Skills. He was a lecturer at James Watt College and later the curriculum manager of the School of Sport, Exercise and Outdoor Studies. He has played a new role as a cross-campus manager for Essential Skills.
What do you mean when you say essential skills?
There's a confusion all over the world what is meant by essential skills. People call them soft skills, core skills, graduate skills. What we try and do is define what these skills are. The skills are skills for life, learning and work. These are the skills that will get graduates a job, keep them a job and progress them in a job. So my talk is about what we've got at West College Scotland. We've defined what these skills are through research. We have indicated 40 skills that are important for when graduates and when students leave school. If they haven't developed these skills, they will struggle in the world of work. I don't think it's that far behind, to be honest. I've travelled around India the past 2 days and travelled to 3 universities across India, and I spoke to first-year students yesterday, and they have those soft skills. They were questioning me, they were confident, they were standing up, their communication skills were excellent. I think our education systems are developing these skills. The only problem we have is the students don't recognise these skills are being developed, and that's what they have when they go for an interview and somebody asks them, what skills do you have? They get tongue-tied, they get confusion, and then they don't have these skills. But they definitely do and are developing these skills in all education systems. It can be done better. It can be done better, of course it can.
Dr. Ravi P. Singh is the Secretary General of Quality Council of India and joined the organization on 29 September 2014. Dr. Singh also served IGNOU as the Director of the Regional Services Division and then as the Senior Regional Director in Delhi. Dr. Singh was formerly the founder Vice Chancellor of Sharda University at Greater Noida.
The 10th National Quality Conclave has come to a final summation today. What are your views on the 2 days, or should I be saying the 3 days that went all through, from the press conference, the release, and then the 2 days of conclave that happened?
The 10th National Quality Conclave was a huge function. And for the first time for the last 10 years, this year we have seen the magnitude of this conclave going to more than 3 times the earlier conclaves. And the biggest advantage of this particular conclave was that we had a lot of international partners coming to India and wanting to become a part of the Indian story. And this story is a new development. The hype around Make in India, Skilling India, the Digital India, the yoga, International Yoga Day, and the emphasis that we have laid down on zero defect, zero effect, Z model that Quality Council of India is doing has been huge. And the support that we are getting from the American National Standards Institute, ASQ, the Japanese institutions, and the German Society for Quality, everybody is here. And that has been the defining character of the 10th National Quality Conclave.
The second day of the 10th National Quality Conclave was full of brainstorming and thought-provoking sessions, making this conclave a huge success.
This is the first time I am coming to this the quality conclave in here Serifort, and from last 2 days I got to know that the different experience, new experience that was implemented in the healthcare sector, and surely I am these things, these learnings will be implemented in the hospital going forward, and this is a very good conclave I am attending, and thank you so much for this conclave.
The 10th National Quality Conclave came to a final summation on the 8th of August 2015, which saw a plethora of eminent speakers from all across the globe come across and put strong viewpoints on healthcare and education. Well, as we all know, the theme of this year's conclave was somewhere bringing about a better ecosystem for world-class quality. And that is exactly what was kept in the mind of all the spectators, all the eminent personalities who came and spoke on the concerned topics, as well as the entire press and media who was present. Well, it obviously left us all with a lot of points to think on as to how we Indians can take our economy a step further by improving healthcare and educating our major part of the economy, which is rural, on healthcare. Definitely, this is yet another step towards a better future for us as Indians, and a better future for the entire world globally as a whole. Well, on that note, it is time for all of us from over here in Doordarshan to say a goodbye to all of you. But we do assure you that we'll see you once again next year in 2016, hopefully on the 11th National Quality Conclave. Till then, it's a goodbye from all of us.